Hey everybody, so today we are answering your questions about labiaplasties.
What should I consider when choosing a surgeon to perform a surgery?
I think you should consider obviously surgeons that have done the procedure many times, who have experience, who have good reviews, and who have nice before and after results, so you can actually see their work.
Who is a good candidate for labiaplasty?
So, a labiaplasty is a very personal procedure, and I think it depends on if the patient is actually feeling that they need a labiaplasty. Now, obviously, there are many times where I would turn away a patient who thinks that they need to get a labiaplasty, who doesn't really need it. But some things to consider. One is length of the labia. According to statistics, anything over 4 centimeters does cause problems physiologically, and asymmetry. So if there's any asymmetry, that can also cause problems. So I would say those two cases are the cases where you would definitely need to look at surgery to treat the problem.
What happens during labiaplasty?
So during labiaplasty, what happens is first, we'll have a good chat with the patient, decide exactly what needs to be done. Because the procedure, the patient's awake, I like to get a lot of feedback. So before we begin, I'll draw out the area and everything so that they can see what the result is going to look like. And it's really in the hands of the actual patient so that they can say, yes, I want more or less or this or that. We can discuss it at that moment. Then I put in the anesthetic, numb everything up, remove the excess tissue, suture everything down, and then afterwards close it up, and that's it. It's a pretty straightforward procedure. We take off all the excess tissue and you close it. It usually takes about 30 minutes to an hour, depending on what we're working with. And then when everything is done and the aftercare is over, you go home. You don't even have to wait in the hospital at all or in the clinic.
What are the risks associated with labiaplasty?
So risk-wise, the major risks, obviously you're going to get swelling and bruising, that's with anything. Infection, I'm going to give you some antibiotics prophylactically. Thrush, because of the antibiotics that you're going to take prophylactically. There's a lot of blood vessels, so there's a risk of bleeding. We cauterize everything to make sure that there is no bleeding. Unfortunately, I'm going to mention this, a lot of patients, because the procedure is so quick and so smooth and everything is great, they feel like that they can do whatever they want. You have to take it easy for a couple of days. I would say 2 weeks, really take it easy. I even had one patient who decided to go party that evening after a procedure, and needless to say, they ended up in the hospital. It's a surgical procedure. It doesn't matter how quick it's done, you have to take care of yourself. Then other risks are sutures dissolving quicker than other sutures, and the reason is because of the pH changes throughout the cycle. We want to make sure that the sutures stay in for 2 weeks so everything remains closed. Keep everything nice and clean, obviously. Other risks, hematomas, things like that. Again, protocol. Hematomas, things like that. But again, if we cauterize and we don't allow any bleeding, we shouldn't get any hematomas. So the biggest problems that I've seen actually are the swelling and bruising, and then that goes away with time. So,
how does labiaplasty impact sexual health?
So, many of the patients that come in to get the labiaplasty treatment come in because of discomfort and pain during sexual intercourse. They also come in for psychological reasons, because they don't even like what they see down there. So it really helps their sexual life. The one main reason for having discomfort is a lot of patients, they complain because the lips are so long that they get dragged into the vaginal canal, causing pain and discomfort, so they avoid having sex. Other patients also complain the fact that they don't like what they see down there. They don't want anybody to see it. I've had patients who had been married for years and their partners have never seen their genitalia, their vulva at all. They avoid turning on the lights. They're embarrassed. They're afraid to be seen. How can you be comfortable? You're gonna be suffering the whole time, afraid that you're gonna be seen. And part of the sexual experience is to be seen. So obviously with the pain and the discomfort, after the labiaplasty, after the 6 weeks and everything that you need to get healed, works just a lot better, and there isn't that discomfort anymore, and you're not afraid of showing who you are. So it actually really improves, and a lot of women, they come back and they say how much it's changed their lives.
What kind of results can be expected from labiaplasty?
So the results really depend on the patient. So the patient guides the results. They show me what they want in the end, and I make it happen. So some women want everything to be flush. Some women just want some things to be, trimmed down. Some women want things to be more symmetrical. To get to the point that they feel comfortable and that they don't feel the discomfort and the pain when they're wearing clothes, when they're doing certain activities, or even during sexual intercourse. So I guess that's it for now for the questions about labiaplasties. I'll see you guys next time.